welcome back. Today we have a real tough topic. Are you aware of Alzheimer's? Not easy. But you know there's people fighting to help people with Alzheimer's? My name is Vin Dacquino. Our guests today are Denise Kuhbier and Tina Eckert. Hey, welcome.
Thank you.
You guys have been fighting, working hard to help people understand what Alzheimer's is and helping people who are living through the pains and difficulties of Alzheimer's. Tell me a little bit about you, Tina.
I am Tina Eckert. I'm a walk manager for the Walk to End Alzheimer's in the Hudson Valley. I've been with the organization just about a year, however, not new to the non-for-profit world and realm. I'm out of our Poughkeepsie office.
Oh.
And we have offices throughout the Hudson Valley.
And I mean, what actually do you do? Do you help Alzheimer's patients or people who are helping Alzheimer's patients?
Yes, so my specific role is a walk manager, so I'm on the fundraising side of the organization. I'm the person that gets the money. So that
do the things that you need to do.
Exactly. So our organization provides care and support for those battling Alzheimer's, for families and for their caregivers.
Yep.
So
very difficult.
Yes, very difficult.
Because in one way you have the person in front of you, and another way you don't.
Right. I mean, and I've heard people say many times in the first year that I've been with the organization that we lose our loved one twice.
Yep.
You know, first to the disease
Yep.
and ultimately to their passing, which is horrific.
I'll never forget my father's sister, my Aunt Vita, had a best friend, and I was at my Aunt Vita's daughter's wedding. And her best friend came to sit next to her. And then her best friend's daughter came to sit next to her, and my aunt said, "Oh, what a lovely girl, who is that?" She'd known her since she was an infant.
Sure.
And her friend said something I'll never forget. She said, "I miss her so much."
Oh.
And there she was, sitting there. And it wasn't until a while later that I realized that physically she was there.
Right.
But she left us in many ways.
Right.
And she just wasn't there. She didn't even know who we were anymore after a while. And it was heartbreaking.
It is. Sure.
Yeah. So, talk to me, Denise. Who are you and what do you do?
So I'm a volunteer for the
Yep.
Alzheimer's Association. I'm a nurse. I've been a nurse for over 30 years, and in the
So
health
you work
profession,
directly with the patients?
I do. I work for a company
Wow.
called Lean On We, and we help people find private duty aides to hire at home. We're like a matchmaker.
Wow.
So that's my full-time life, and my volunteer life is really to help the Alzheimer's Association. I'm on the board of directors, and I run the Putnam Alzheimer's Walk.
Now I think you have a flyer for
Yep.
that.
Yep, I absolutely do.
Right. So this is the Join the Fight for the First Alzheimer's Survivor. Now that is September 21st. Public's invited.
Correct. So we're
And the
here.
idea is to help raise some funds and raise awareness.
Correct. So we're here today to really raise awareness in Putnam County and all over the Hudson Valley, because we have alarming numbers of people that have Alzheimer's.
Yeah.
And for me, being a nurse for so many years, I see the impact every day on what this disease does to families and to clients, but really to families. How the families are suffering more than the client is suffering. And it's painful to watch and painful to hear. It's every day, 10 times a day, someone will call and say, my mother, my father, my grandmother, my husband has been diagnosed, what do I do? And so I really find time in my life to help to eradicate this illness, because it is really terrible. And Tina has some statistics that she can share about the alarming numbers of people that are diagnosed with Alzheimer's every day.
Yeah, that's please.
Well, so for example, Alzheimer's is a national crisis. Right here in the Hudson Valley, 40,000 people have been diagnosed with Alzheimer's, and every 65 seconds, someone's diagnosed with Alzheimer's. So while we're sitting here in this half an hour that we're doing your show, 26 people are going to be diagnosed.
And so to be clear, what one of the symptoms is that they just lose their memory. They don't know who you are, and is that I mean, that's my impression.
Well, yes, absolutely. That is an effect of Alzheimer's, and Alzheimer's. So, dementia is the overall. Think of dementia as the overall umbrella, and then Alzheimer's is one form of dementia.
Okay.
So, the Alzheimer's Association, we not only fight Alzheimer's but other dementias as well. So, Alzheimer's. People think, okay, that's just a sign of getting older. I mean, yes, we are all at risk, and the common denominator in Alzheimer's is age. We all are going to age.
Yeah.
We all have the risk
We all
factor.
become forgetful in some ways.
But there are 10 warning
beyond
signs
forgetful.
of Alzheimer's that folks can watch out for, and Denise can talk about those a little bit. I mean, there are things to watch for. For example, if you're a college student and you come home and you see that your loved one is acting just a little bit differently, take note
doesn't
of
seem
that.
to know who you are.
Or their personality has changed, or they're more forgetful. Be mindful of that. Don't deny it, and just make sure you have a conversation with who's around that person all the time. And Denise can talk about some of the warning signs folks should be watching out for.
Yeah, and there's as many as like 10 warning signs.
There's 10, they say know the signs. And if you want to look up the signs, you can go to alz.org/10 signs. But I'm going to touch on them.
Just to touch on.
Yep.
This
So you
sort
mentioned
of
memory
subheading.
loss and
Yep.
how it disrupts your daily life. And we always use this analogy. If you put your keys down and you forget where you put them, that's one thing. But if you
Put them in the freezer.
don't know what to do when you find your keys or what they are, that's really
where
the problem
comes.
lies.
Right.
Another one is challenges in planning or solving problems. Right, the inability to solve very simple problems that in the past you may have been able to solve without any difficulty. Completing tasks, very familiar tasks. It could be a lot of people like bathing and dressing and turning the stove off, right? Just very simple things that are very
could be
dangerous.
Yep.
Confusion with time or place. A lot of the clients get confused if it's day or night, where they are. Just like Tina mentioned on the way here, there was where did you see it?
Along I-84, you see those big signs saying missing adult. 9 times out of 10, it's an adult who's wandered from Alzheimer's. So, we just have to be mindful of those folks.
Or got in the car driving.
Right.
They got in the
And
car.
then, I know. I had another aunt. She got into a little fender bender, and when she got out of the car, the police officer said, I see you had a little accident. She said, no. He said, but look at your car. She said, I didn't do that. I don't know how that happened.
Right.
And that was the beginning. And then from there, it just kept getting worse.
I mean, we all have stories. It's important to share them. So I'm happy you're sharing your stories. I mean, and Alzheimer's awareness needs to become more prevalent. So
Everybody's been touched.
Yeah.
People talk about it differently, or people don't want to talk about it sometimes.
And it's nothing to be ashamed of.
Right.
It's not something you cause. It's something that happens.
Right.
and there's
Understand.
help.
Can we
So
have
there's
more?
some more like trouble understanding visual images and spatial relationships. So just their depth perception is off.
Going to put something on a table and missing the table.
Missing the step when you go to walk down steps. New problems with words and speaking or writing, just being able, not understanding or not being able to speak clearly, get the words out. Right. Not like you and I, we forget a word, and maybe later we'll remember what we forgot, but they don't do that. Misplacing things and losing the ability to retrace your steps. I know that, like when I forget something, I'll go, wait a second, where did I put that? And I'll retrace my steps to find what I was looking for, but they cannot do that.
Right.
And a few more, a decreased or poor judgment, their judgment's off. Maybe they're going out at night dressed not properly for the weather, or they're driving in a storm, or so bad judgment like that. And then withdrawal from social activities, and it's like that there's something wrong.
Are they aware that they're doing all these things?
Yes, I mean typically in the early stages you
realize, oh my God, what did I do?
Right.
Yep. And I think that's the hardest part, when you're forgetting.
It's happening.
it's
you
almost
feel it coming on.
Yes, and you know you're forgetting, and you know there's something you have to do. Like, this is the time where people will have calendars and alarms and all reminders and Post-its around their house. Don't forget to lock the door, shut the stove, take my medicine. So there's all kinds of...
Now, is there a system to this? I mean, does it happen like in order, or it could be like first you start forgetting things and then another time you're displacing things or not understanding? I mean, it doesn't happen in a logical order, right?
I mean, I think the disease manifests in different people in different
different
ways,
ways.
and
That's-
it progresses more rapidly in some people than oher. So you really can't.
So you can't really say, okay, well, they did this, now they're going to do this. It's not like the stages of grief. It's just things happen in various stages depending on who you are, and also probably the intensity of it is different for different people.
Right.
So is it relatively a long period of time, or, I mean, is it like, in 6 months you're really going to be in bad shape, or who knows?
No, I mean, that's the hard part too.
unfortunately, that's
It's
the
not.
hard part.
It's not. I don't know if you have numbers, but I would say I've seen people that I couldn't even put a number on it.
Yeah.
It depends, some
Some people can happen within a year.
Yeah, we hear the evidence. I mean, it could be 10 years. It could be 2. It depends on everybody's individual biological makeup.
And is this hereditary?
Yes and no.
And no.
It's been.
Yep, I've heard the same thing.
It's been in families, and you see it concurrently happening.
And you get nervous.
Right, and then out of the blue, all of a sudden there it is.
Male, female?
It's more prevalent in female than male. So, and we have on alz.org, the Alzheimer's website, there are all the statistics. We have great facts and figures that folks can go to the website and look up, and you can see all of those, yes, male of this ethnicity, or females of this ethnicity. So you can definitely view that on our website.
And I imagine that one of the toughest things is denial.
Oh, sure.
I mean, you want to say, I'm just forgetful. But sometimes it goes beyond. When it continues to keep getting worse, who do they call?
Well, they should definitely call the Alzheimer's Association. We have care consultants on staff that can help folks
And
walk
again, you shouldn't
through
be
those
embarrassed.
phases. Oh, no.
Just call up and say, look, my mother's just hasn't been herself.
Right.
And she's been doing this and this. Should I worry?
Right.
And I'm sure there must be cases where you say, well, that's pretty common. However, if it increases, why don't you call us back? In fact, why don't you call us back anyway?
Right.
Yeah.
No, definitely. We have care consultants there ready to help 24/7. Folks can, again, on our website, alz.org, or 800-272-3900, folks can call.
Okay, say that again slowly.
800-272-3900.
Okay.
Folks can call 24/7, talk to one of our care consultants. And a family, you don't even have to be diagnosed with Alzheimer's or a dementia to call us to get the information you need. Even if you think this is happening, we can help direct you to get the right answers.
Because time can be of essence too,
Oh,
right?
well, yes. I mean, and unfortunately, we're seeing more and more early onset cases of Alzheimer's now. So even in us younger folks, if something's a little off, call us, because we can help direct you through the right, get you the right answers. We can direct you through the processes of finding the right answers. It's so important. So if something is off, I can't stress that enough. It's so important to call and let us help you.
And you don't want to, again, it's so important not to say, I don't. Yeah, it's normal. It's not normal. Sometimes it's not normal. Well, and just get the assurance that it's not normal is important.
Right.
It's a free service.
Right.
The Alzheimer's
it's a free
Association is
service.
a national organization.
Right.
Fundraising goes towards programs and care. So when you call, you're talking to a professional, and it's a free service. And I think people really need to understand that about the association.
Yes.
And and if you truly love someone, you have to sometimes tuck your pride away and say, hey, things do happen to people we love, and if we really love them, we need to give them the help they need. and they're not going to be able to do it all the time.
Right.
So you have to do it for them.
And you bring up a good point, because if you're caregiving for someone and you're totally stressed and you need a break, we have time away programs that can do something special for the caregiver so they can have a break.
Yeah.
And
Well,
that's
I
so
know.
important. I mean, the statistics are something like 34% of caregivers pass before their loved one diagnosed
Yeah.
because of the stress of caring for someone with the disease, because we
And
want
it's
to keep
24
them.
hour.
Right.
I know.
Right, and we want to keep our family members home. We don't want
Yeah.
them
Yep,
to have to
I
go
know.
to
We're
a care
going
facility.
through the same thing. My mom, God bless her, is 92 years old, and some days they're not good days.
Right.
And it happens. And my sister has been a saint in watching her. But it's 24 hours.
Sure.
In the middle of the night,
Right.
she wakes up, and it's hard. Aging isn't easy.
No, well, hopefully us, the Alzheimer's Association, can help that a little bit. We want to help folks. That's why we raise the money that we raise, so
Yeah.
that we can help
Yep.
folks locally. We have offices throughout the Hudson Valley. So the Walk to End Alzheimer's that we are having on September 21st here in Putnam County, the funds raised go to support these programs
So
that are
now
so
tell
needed.
me a little bit about that event. What happens?
We have a walk. It's in the upper park of the Veterans Memorial Park.
Okay.
Starts
and
at
so people all gather together.
Yep.
And they it's not like a protest. It's
Oh, no.
a walk
Well,
in
we're
support.
protesting Alzheimer's.
Yes,
We're
that's
done.
right.
We don't want this anymore.
There you go.
No, we usually kick it off with a little bit important information about the disease and what's happening.
So we have a couple little booths there or something?
We do. We have vendors. We have vendors
Good.
that come
Oh,
and set up.
okay.
Maybe they have some relationship to the disease, or maybe they want to share their own information. We
Great.
do have booths where you can find out about programs and services. And we typically have around 500 walkers that
Wow.
have,
Yes.
that have
Good.
been touched in one way or the other by
Yep.
the disease.
Yes.
And we walk around the park a few times. We raise money. We give you lunch and breakfast.
Ooh,
And
that's
you hang
good.
out and have some game. Do
Mention
Children's-
food, you got me.
Right? Children's activities.
children's activities,
Bring your
face painting,
family.
Nice.
things like that. It's
So
really-
it's a family event.
Definitely.
absolutely,
Good.
absolutely.
And it's not just some solemn,
Oh, no, no.
Oh no, no.
Yeah.
There's also a lot of teens that are learning about the disease themselves because their grandparents or their own
Right.
their own parents are exposed.
Yeah. And
we're
that,
teaching.
I mean, that's one of the most important things you said today.
Of course.
It's not all 90-year-olds.
Mm-hmm.
There's people today 40 years old who, who are suffering from Alzheimer's.
Right. Not just grandparents. Sometimes it's parents.
Parents, yeah, and it's and you kind of have to know, and I hate to say this, but I will, is that sometimes we can become impatient with people with Alzheimer's because it's like, pay attention.
Absolutely.
They realize they
Right.
can't. This is not something they're doing on purpose.
Right.
They're forgetting things
Right.
because it's something medically wrong.
Right.
Everybody
And-
forgets that it's a disease.
It's a
right? It's a disease,
disease,
and
right.
they
It's
forget.
not- yeah.
And that's why the Alzheimer's Association can teach you tips.
Right.
And I don't want to say tricks because that's the wrong word, but it's
Yeah.
really tips on how to deal with a loved one that keeps repeating themselves over and over. It's
Over and
very
over again,
difficult.
yeah.
Right.
It's really difficult.
I know.
I used to run a assisted living, and I would go down to the memory support floor, and the clients would say, where's my husband? Where's my husband? Where's my husband? Over and over, and I would have to keep saying, he'll be here in a few minutes. But I was saying that because that was the only answer I could give
Yes.
that would distract them.
Right.
Because I really couldn't say, well, he passed away 20 years ago, because you're
Yeah.
not supposed to do that. So
I
it's
know.
really about redirecting.
With my aunt, her husband, they were married for over 50 years. And it got to the point where when he went to the hospital, she says, "Oh, my father's here." And it broke his heart
Sure.
because they were so good. And she was such a funny
Sure.
lady. She had such a wonderful sense of humor. And it's just, she was there, but she wasn't there.
Right.
And sometimes it's harder on the family than it is on the person.
course,
The
right.
person doesn't know what's happening always.
Very true.
And it's when you lose someone who's there, it's heartbreaking.
True. Very
It's
true.
the shell of who you know is there,
Yes.
but inside it's vacant.
Inside, yeah, it's somebody else. And I know when I went to visit my aunt, there was a picture on the wall of a little boy chasing two girls around a tree. And she said to me, I was looking at it, and she said to me, "Look, there's little Vinny chasing my daughters. Look, he's so fresh, he's so fresh." She had no idea she was talking to me.
Right, right.
You know, and little me was still in her head. And, it's just, there was so much confusion. And again, I have to say this, it was uncomfortable.
Sure.
I didn't know what to say to her, ever.
Sure.
You know, and even though it may be uncomfortable for you, you need to be able to talk to somebody, for someone to say,
Right.
I know you're uncomfortable. And a question I kept asking all the time, and here's going to be a tough question for you. You know, I said to myself, does she even know I'm here? Does she have any idea who I am? And many times the answer is
Many times it's no.
no.
I mean, folks will have moments of clarity where they come back. I mean,
Yes.
when I was 17 years old, going way back, my father had been diagnosed with Alzheimer's, and I remember going to see him. I remember the first time he didn't know who I was, and it was devastating. He said to me, we walked in, I said, "Hi, Dad." He said, "Nurse, can you please get me a drink, if you would please?" And, it crushed me.
Oh, I know.
My father, so you have to be careful not to say, "Wait, but Dad, it's me." I mean, you don't want to confuse them
That's
more.
a wonderful question.
That's
That'll
hard.
confuse them more. Right?
Absolutely.
So you can't really. I mean, so many times I
Absolutely.
want to say, "And Vita, it's me." And when she pointed to that picture, I was like, and I probably did, and she just ignored it.
Yeah, well, I mean, it's our natural instinct
I
to want to
know.
correct folks.
I know.
Hey, here I am. But I think that's where the Alzheimer's Association can help. We can talk folks through, we just in our conversation
Yet
today.
it's still important to visit
we
those
can,
people.
Yes, oh, absolutely.
Yeah.
I mean, but we can just help with, even if you're a friend of the family, we can help you understand what language to use if you talk to someone, and if they react in this way, we can help.
Oh, that's
talk
wonderful.
through
Little tips on
yeah.
how to deal with them.
Well,
I think you
yeah.
mentioned something about little tips to deal with
Did you
that.
tips? The 10 warning signs and
Yeah, there's warning signs and just suggestions on how
Right.
to deal with people with Alzheimer's. And the most important thing is consult a professional.
Absolutely.
So you want to be able to say, I can handle this. She's been my mother for 90 years. Are you kidding?
Right.
But
Yeah.
the truth is, she's not the same person she was.
Well, and what's important too, 58% of our seniors think it's very important to, when you go to your doctor for your annual checkup, to talk about Alzheimer's and to make sure you're being screened, because our doctors, they have screening tests that they can do with folks. Like if you're a senior and you go for your annual checkup, make sure, your doctors are giving you that screening.
Yeah.
Only 16% of seniors ask for that.
Now, should you, as an observer, take notes? Say, look,
Sure.
yesterday I said to her, how is so-and-so? And she said, who's that?
Yeah,
She
sure.
didn't know who I was talking about. She recognized the
Absolutely.
name. So it might be a good thing so you can do that.
Absolutely. If you're a family member, especially my mom is in her 70s. If you're watching, I told your age. But, it's very important to, I watch her all the time.
Yeah.
I make sure, when she says something, okay, she's also on a lot mind. So keep that in mind too.
That's right.
Medication
sometimes medications
can
can
mess
knock
with your
you up.
memory. Sure.
Oh, yeah.
So you just got to be careful. But taking notes is very important. So if you go with your loved one to their appointments,
And you
make
say,
sure.
Listen, these,
Yeah.
the person says, oh, no, I don't really
Yeah.
forget. And you
Yeah.
say, yeah, but remember when you did and yesterday when I said this, you said this. And
Yeah.
I suppose that could be helpful.
Yeah, just keep,
Sometimes it works, sometimes it's
Yeah.
just,
And there is denial. You
Lots of
don't
denial.
want this to be happening.
right.
And sometimes it's easy to say, oh, that's normal. and it's not always normal.
Right.
I think what's also important is that you rule out other things before you make your own diagnosis that it's Alzheimer's. Sometimes other illnesses like a urinary tract infection will make people extremely confused, and
Yep.
they don't have any other symptoms
know.
except an incredible amount of confusion. So when I get phone calls about my mother, my aunt had a quick decline, my first thing is go to see your medical doctor and rule out
Happened.
urinary tract
Happened
infection.
with my mother.
Yep.
That's exactly right.
And then once they get
it's
cleared
funny that
up,
you said that because
Yeah.
I never
Yeah.
even connected that.
Most people
and it
don't.
turned out she did have a urinary
right.
infection.
yeah,
And then she was better.
yep.
Yeah, with the right medication. So that's good. That makes me feel a little better that
Yep.
that's what it was. Well, I have bad news for you. We have about 2 minutes left. Take a quick look at your notes. Is there anything that we need to say to these people so that they're absolutely clear about what they should know about Alzheimer's and your organization?
Absolutely. You should know the Alzheimer's Association is here to support you, regardless of whether there's been a diagnosis or not. You can visit alz.org/Hudson Valley, and we're here. We're local. We're
All right,
wanting
make you
to
say
help
it
you.
again. What is it?
alz.org/
ALD.
Z as in zebra.
ALZ.
alz.org/Hudson Valley. We're here to help whether you're diagnosed or not.
There it is. Jot it down.
We have many programs and services that can help you, and please support our walk to end Alzheimer's because we definitely need the funds
That
to
again is
continue the
September
fight.
21st.
Yep, September 21st at the Veterans Memorial Park,
Yep.
the upper
And if you-
level.
Yep. Good.
And if you'd like to join the walk, you can go to putnamwalk.org.
PutnamWalk.org. .org or .com?
.org.
Oh, .org. There it is. PutnamWalk.org.
Yep.
God, for a minute there I could have sworn I saw .com.
We'd love to have you, and we'd love for you to come out and get to see the services that are in our county, right here in our own
Perfect. And it's
backyards.
right here in
Right
your
here.
backyard. And you can do this by phone or you could do this in person.
Absolutely. Sign up yourself, sign up a team, sign up as an individual. We want to have you
Terrific.
there. Come just check us out. It's a fun
And what time
morning.
does it start? It's his morning.
9 a.m. registration.
Wow.
10 o'clock the walk kicks off, or well, 10 o'clock starts our opening ceremonies, which we have a wonderful flower ceremony, and then at 10:30 the walk.
Sounds
You'll
wonderful.
walk the walk.
Ladies, I can't thank you enough.
Thank you.
There is nothing more heartbreaking than losing a person who's standing in front of you.
Exactly.
Keep doing what you're doing. We need people like you. I certainly appreciate what you're doing. Please, join the walk. Go there with other people. Be heard by people who you love and may have lost. Not physically, emotionally, mentally. Thank you so much for
Thank
being
you.
here.
Thank
It's
you.
absolutely a
Thank you for
pleasure.
having us.
Thank you. Keep doing what you're doing. Stay present. Thank you for joining me and Tina and Denise and people with Alzheimer's. Thank you for joining us one-on-one.